Hi, folks, and welcome. I am so excited to virtually see you all. My name is Dr. JoAnn Yanez, and I am the Executive Director for the Association of Accredited Naturopathic Medical Colleges. And so today we have a different event. We're going to have a lot of different things for you today, including a What is Naturopathic Medicine with me this morning. We're going to have some drop-in chats with our member schools in different links. So you should have received the links for the different events for the day. We will have a student panel at 3 o'clock Eastern, an alumni panel at 5, and then some evening chats with drop-ins with the schools again at 5:30 Eastern. So super excited for all of the different things. This is the place to come if you have questions about naturopathic medicine, anything that you want to learn from the schools, what your pathway looks like as a student, how you apply, all of the different things. So we're here today to help you really make the most of this day and find the things that you're looking for so that you can make an informed decision, apply, be a really solid candidate, and hopefully be on your way to be a naturopathic doctor. So very, very excited to have you all with us. This is a webinar, so everyone is in listen-only mode. I do prefer, if you do have questions, please use the Q&A function, not the chat, because it's a lot harder for me to monitor the chat than the question and answer box. So please put all your questions and answers in there. But if you wouldn't mind just throwing into the chat, where are you coming from? What city, state, province, et cetera, where are you at? I am currently in Phoenix, Arizona. So where's everyone coming from? Feel free to plop that in the chat. Hi, Amara. Toronto, yay, Canada. Awesome. Atlanta, great. So Maine, fabulous. Minnesota, oh, we've got people from all over. This is wonderful. So welcome. So with that, with no further delay, I am going to be going through just a real basic of Naturopathic Medicine 101, kind of what are the basics here, and then we'll have plenty of time for you to get over to the school chat and make your way over there for the drop-ins. So naturopathic medicine is founded on the 6 principles. The 6 principles really guide everything that we do as NDs, and how we think, how we address patients, and even how the classes are taught. One of the really cool things in ND school is that, these philosophies are woven throughout everything in school, from the way that we behave with each other, from, how we teach courses, how we view patients, all of that. So first, do no harm, recognizing the healing power of nature, identifying and treating causes of illness. The doctor is teacher, treating the whole person, and the power of prevention. This slide, I like to think of this is called the Therapeutic Order of Naturopathic Medicine, but I honestly think of this as how naturopathic doctors approach thinking through patient cases. And so really what this is it's a guide. It isn't a Bible or, you must, tome that you must do something a certain way. This is really just a guide that guides our practice. However, it really shows people how we think of patient cases and why some of the things that we do as naturopathic doctors are so important. So the determinants of health are really the foundation for what we do as naturopathic doctors. This is things like stress and sleep and nutrition and movement and healthy thoughts and social support and all of the things that it takes to be healthy and move through this world in a healthy manner. And so that's why a lot of times you'll see us talking about nutrition and physical medicine and the importance of mindfulness and stress reduction and all of that, because it's so important to the totality of our health that if those pieces aren't in place well, everything else, the whole house of cards can fall down. And I think probably most of us, show of hands, if you have had your health kind of take a tumble, if your sleep wasn't there or your nutrition wasn't on point, how many folks I can raise my hand there too. So I think, we all recognize that a lot of times, these pieces are so foundational to the rest of our health. Now, the one thing that I do want to bring out, so as we move up the pyramid, so NDs will often, really make sure that those foundational pieces are in play. But then we do have other things, other tools in our toolkit, so to speak, for treating patients. And so stimulating self-healing, maybe having somebody journal, maybe having somebody do hydrotherapy, where they're stimulating their body's immune system and their circulatory systems, restoring weakened systems. So that might take the form of vitamins and supplements, IV botanicals, you name it. There might be some other things in there. But at the top of this is things like high force interventions, like drugs and surgery, things that suppress pathology. And so, oftentimes, some of the myths that we hear in naturopathic medicine, NDs don't believe in fill in the blank. And so really, it isn't that we don't believe in anything. First of all, this is not a belief system. This is medicine and science, but, there's an appropriate thing and treatment and modality at the appropriate time for the patient. And so, sometimes it is appropriate to go and suppress pathology if somebody is in acute pain and they cannot function, or if some system is dangerously out of balance and needs to be brought into balance. So there is a time and a place. And so really there are so many different tools. And this is one of the things that I think we see our students so excited about, because there is, such a breadth in what NDs are able to do as doctors. So oftentimes our students, we see them from so many different backgrounds, but a lot of times we'll hear this common thread, like, well, I want to be a doctor, but, or I want to be a doctor and I want to use nutrition, and I want to, treat the root cause, and I want to address the mental and emotional health, and I want more time with my patients, and I want a deeper relationship, and I want to honor cultural differences in patients with different types of holistic treatments that may be culturally sensitive to them. So we see all of those different things from our students, including people who are socially conscious, very, environmentally minded oftentimes, and people who recognize that there's so much more to being healthy than, just taking a medication. And so I think those are really the people that are drawn to this type of practice. We have folks from all different types of age spectrum. So, your traditional, post-college, pre-med type student to your career changers and everybody in between. And so we also will see people who either have been patients. We did a survey pre-pandemic, but we did a survey of our students and docs, and many of them had treated or had, family members who had used various different types of holistic therapies themselves. And so, as well as people who come from various different cultural backgrounds where other healing practices may be commonplace. We're often asked, well, what should I major in if I'm, figuring out my college right now? Is there a specific major that I should take? Is there something that I should do? And, by far, we have a large majority of folks who come with the pre-med track, the biological sciences track. However, we have folks from many different backgrounds. And also because we do tend to see some career changers, we'll have people who have done fully different tracks. I remember in my classmates, when I went to naturopathic school, I had everything from the traditional pre-med to a flight attendant, an engineer, a construction worker, an accountant, nutritionists and yoga therapists and massage therapists. Like, we had so many different types of people in my class with many different backgrounds. And honestly, it enriches the academic experience because everybody has such an amazing background and story to share that it really does help us all kind of understand all of the different ways that you can be an ND. So the curriculum, the education is at a minimum of 4 years past your undergraduate degree. The biomedical sciences, so those are all the ologies, as I call them: anatomy, physiology, biochem, et cetera. Those are your foundational courses for medicine, so you understand how the body works, how things happen when it's disorganized and out of balance, and all of that. And then with the clinical education, that is where you are getting your understanding of diagnosis and treatments, and really practicing the medicine. And so there'll be clinical rotations that happen sometimes in some cases in the first year in observation status, and depending on the program, it may happen at different times. But typically this is going to be in community outreach clinics, specialty clinics, the academic medical centers that are part of all of the programs. And so there are lots of different opportunities for clinical medicine practice. And I always tell folks, seek out as many broad types of experiences to learn both what you're good at and what you like, and also what you don't like. It is really important to have that balance of like, oh, wow, like I know for me personally, I had a number of different types of rotations, all different types of rotations, and I loved delivering babies. However, I did not love being on call 24/7. And I realized I'm like, okay, the delivering babies and being with women through this, amazing transition is incredible, but the lifestyle for me wasn't one that I wanted. And so, it's just as important to understand what you like and what fits in with the lifestyle you're trying to create and what doesn't. So really just, I always tell folks, get as many types of different opportunities and experiences as you can. So the naturopathic therapeutics that are woven throughout really are what differentiates us. So things like nutrition, mind-body medicine, lifestyle counseling, homeopathy, hydrotherapy, botanical medicines, and research with all of these things. And so it's really fabulous, in addition to the diagnosis and treatment that you get. So the prerequisites that are required typically are going to be those biomedical pre-health track prerequisites. So things like biology and chemistry, but especially because of the pandemic right now, I always tell folks, really check in early with the admissions counselors, and we'll have these drop-in chats in a little bit. So please check in early with all of the schools so that you can really understand what exactly do you need to do, when do you need to do it, and have everything lined up so your academic plan is totally ready to go. And so that is really, really important. And so I would take advantage, and you can schedule advising appointments today. So there will be admissions counselors available. They might not be able to advise you specifically right this second, but you can set up an admissions counseling appointment and go through your even unofficial transcripts and kind of what is the plan, what do you need to do? So again, checking in with those schools is super important. So the application materials, there's a central application service. Each of the colleges also will take applications on their websites as well. And so your letters of recommendation are required. Interviews right now, especially with COVID, so in person has changed to online. And so interviewing is very fluid. We recognize that, traveling is tough for some folks, getting away is tough for some folks. And so the schools are all being exceptionally flexible in regard to how we are conducting different types of interviews. And we also recognize it's trickier now too, to get the types of experiences with shadowing and finding doctors. And all of the schools do maintain networks of alumni that they can connect you with if you want to have more experiences there too. So we are often asked, like, what is the difference in the education? And so across all of the disciplines, there are core competencies in diagnosis and treatment, in practice-based learning and research, and as well as in the clinical internships and how we do our clinical medicine. The differences really lie in how our philosophy is applied and in all of the different types of therapies that NDs are using every day and that are core. A lot of times we'll hear, well, how is this different from other pathways? And there are a lot of similarities, but what I can say is special about naturopathic medicine is that the philosophy and the holistic approach, the individualized approach for each patient is throughout the education. And it's even in classes like your biochem classes and your anatomy classes where, yes, we're studying anatomy. And I always joke, the bones don't move because you study them in naturopathic school. They are what they are. The biochemical pathways are what they are. But we do touch on the interconnectedness, how dysfunction in one part of the body can impact another, how a biochemical pathway that's off or a detoxification pathway that's off can have so many other ripples. It can have hormonal ripples, can have digestive issues. And so that's why when you see NDs really focus on the big picture, it's because we do believe that everything is all connected. So where did my arrow go? Here we go. So we're also asked often, what are the career opportunities? What can I do with this degree? First off, this is an amazing investment in yourself, in your future. And we have graduates who obviously practice clinically. Some go on for research to be in natural medicine, so the natural products industry. And there are so many different ways that NDs use their degrees. We are authors, lecturers, write books, education, administrators. So there are many, many different ways that this is growing. And this came from our alumni survey in 2020. And so you can see the areas of focus that clinically NDs use. So GI, nutrition, women's health, these are core because so much of these issues oftentimes are nutrition related, are lifestyle related, are stress related. And so it really does reflect itself in the practice patterns that we see with our doctors. So these are some of the employment settings. The US and Canada split up just a little bit. So you'll see again, and these don't add up to 100 because sometimes people will have multiple places of employment. But again, a large percentage of folks in clinical practice, either group or solo. We do have folks in universities and colleges, speaking in the natural products industry. Like I said, multi-billion-dollar industry that is growing. And so lots and lots of things available there. And then the other thing that we see with our profession is a lot of satisfaction. People really feel, now you're never, and I always caveat this, I don't think that there is any profession at all where you have 100% satisfaction, where everybody is happy with the choice they made. Nobody made a mistake. Nobody picked wrong. Like that's just life. But what we do see is a very, very high level of satisfaction in the choice of being a naturopathic doctor, because it aligns, the folks that are drawn to this. And if you're here today, there probably is something that's resonating with you as well. But the people who are drawn to this are drawn to something that aligns with their passion. It aligns with their beliefs and how you move through the world, and how we see, nutrition is important for me. Nutrition is important for the way that I would practice as a doctor, and treating the cause. Like, it all just makes sense. And so when you have that marriage of your personal philosophies and how you move through your existence as a human with your career, there's a much more higher probability of being satisfied. So the office visits are a bit different with naturopathic doctors. They're a little longer, typically, and it provides for this more in-depth relationship. So they're regulated practice. So there's the naturopathic physician's licensing examination, parts 1 and 2. And then there's also the College of Ontario naturopath exams that are used in the province of Ontario. And all of those are available to graduates from the accredited programs and required for licensure and regulated practice. So here are the regulated jurisdictions that you'll see in the dark teal. And we have all of this on our website as well. And then we have our member schools with us. And so I recognize that we are going to have our drop-in sessions starting in just a couple minutes. So I'm going to take just like maybe a couple questions, and then we can move those over to the breakout rooms for the drop-in chats, which is a different link. So just want to make sure. So I did see there was a hand raised. Let's see the question. Hello from West Lafayette, Indiana. Hi. So are there any questions from the audience before we move over to our next spot? So please feel free to type your questions in to the Q&A. That would be most helpful. Sierra, I see your hands raised. Let's see. Are NDs considered PCPs, primary care providers? They are. So there are a number of places across the US where naturopathic doctors can practice as primary care. And that really just means primary care is more of an insurance term. That means that you can be the first entry point into the healthcare system. And so that is how NDs practice. Are all schools face-to-face? Yes. So because of accreditation, there is no strictly online program or course of study. One of the programs in Oregon, the program in Oregon has moved their first year online. They do have an online option for year one. However, you're studying to be a doctor. You have to touch patients. You have to learn how to draw blood. There are so many hands-on components to education that really, there does need to be a physical in-person component, and your supervisors have to watch you do things. They have to make sure that you're safe. So yes, it is face-to-face. However, there is, the pandemic taught us how much, what are the things that we can do safely online without losing some of the sense of the quality of education, the interpersonal relationships that you have with your classmates, and so on. Let's see here. So another question, will a degree from a college in Canada transfer to the US? Yes. So as I said just a moment ago, graduation from all of the accredited schools will qualify you to take the naturopathic physician's licensing exam. And so that is the requirement. So if you graduate in Canada and you think at some point you would want to practice in the US, you definitely need to make sure that you take the NCLEX examination so that you will be eligible for licensure in the US. I've a question here. Some NDs having their master's beneficial for further. So education is an investment. And your investment really should mirror what you're investing in. So, if you want to practice and, do midwifery or acupuncture or chiropractic, sometimes people will find other degrees will be very helpful for that. But it's not a requirement. So question, do most US citizens end up going to the US schools and Canadian citizens to the Canadian schools? So it really depends. There is cross-border. I know, during the pandemic, crossing the border was a bit more challenging, but we're hoping that things are going to normalize soon. So you can potentially go to a school in another country. You just have to, I always tell folks, like, you're going to have to incur the legal fees, the visa applications, like everything that is required to be in that country legally does fall on you to do. So I'm going to motor through just a couple more questions here. And what are the clinical rotations looking like during schooling? So clinical rotations, you will be rotating through many different types of practice settings. As I said, so the academic medical centers, community clinics. There are all different types of community clinics depending on the school. There might be homeless shelters, there might be domestic violence shelters, there may be low-income pediatric centers, HIV centers. Like, there are all different types of community clinics that exist depending on the school and program and what they're affiliated with. There may be specialty organizations that do like oncology, where you're running through different types of oncology settings. So again, lots and lots of different types of practice settings that are available. So what I am going to do is I am going to ask, hold on to your questions. We're going to open up the chat for the schools, and we can move over those questions over there if that's okay. So kind of jot your questions down. I'm going to go ahead and close this out, and we're going to open up the next session with the links. So if you have any questions, please email events@aannmc.org if you run into any issues during the course of the day. So again, that is events@AANMC.org. So please bring your questions over to the next spot so that we have time to get you over there. All right, so I'm going to see you in a few seconds. Thanks.